Well, it's 8 o'clock, and this is Hobart from the Homeowners Representative Board, and Susan Perlman is here. Susan, can you say hi?
It's unmuting and unvideoing. We're both here.
Okay.
This is Eric Perlman.
Hobart, good to see you.
Susan.
Yeah. And of course,
Cindy.
Cynthia Haig, who's going to help us and guide us today on information that may be useful as we examine your questions around medical concerns and other concerns that folks at UCI and particularly University Hills may have. I'm going to turn it over pretty quickly to Cynthia. Susan has a couple of announcements about how you can find out more about things in University Hills, how we're communicating, and some of the ideas that folks have had. There's a welcome and wellness committee.
There's a kind of a Zoom meeting. I'm hoping they can't hear me.
Hi, Carol.
Glad you're here.
We were just doing introductions.
Okay.
Oh, I'm Carol Ulaner. Hi.
Yeah. Okay. All right. Bye.
So I'm gonna turn it over to Susan in just a moment. I just want to say how impressed I am with the support that we've had from residents to be supportive of each other. We've had 32 plus households put aside a little time saying that they would volunteer to help others who have any particular needs, whether it's mundane stuff like groceries or more serious assistance. And we want to thank those folks. You can go and check out ways in which you can link to help out if you want to do so. We have a new Facebook page for Welcoming and Wellness, and Susan will tell you a little bit about that. The Entertainment Committee also has a Facebook page, so these are ways in which we keep in touch. And of course, the listserv. We want to try and encourage as many people as possible to go ahead and get on the listserv, because that'll be the first point of communication within the community. Soon, hopefully, Aisha will be back up and we'll have the ability to bring the web page up to date, as well as receive communications through Aisha via the constant contact email system. So without further ado, I'll pass it on to Susan, and I'm muting.
I think that was great. However, our Facebook page needs some love and attention. So anybody who wants to jump in there and post, that would be great. Anybody who wants to take it over, that would be even better. But I am delighted that we got it up and running when we did. I'm delighted that we have been able to get out the information in order to get people back. And we did that on Friday evening, just before Aisha was sort of out of commission, as they're starting to develop their processes virtually. So we were able to get the message out and ask for people's help and ask for people who need help. Having said that, if there are people that you know that are in the community who need help and who are not on the listserv or are not inclined to ask, let us know, and we'll see how we can work through that. That's our mission. That's really important to us. So, and our mission is, as I said, to get as much information out as possible, and that's why Cynthia Hawk has been so gracious in offering her time to answer questions, both questions that would be common to many of us. Eric and I went to the grocery store today, and I drove him nuts all through the grocery store. Don't touch that! So
I touched it anyway.
those are basic questions. There's a lot of basic. Cindy, you said you were swimming. Is that okay? Those kinds of questions. But there are unique questions, I think, that we want to have answered as well. So now I will turn it over to you. Thanks, Cindy, for doing this.
Well, hello, everyone.
Also, thanks to Hobart and thanks to McKaylee And thanks to Andrea, who are all of our committee making this happen. Sorry.
Thank you. Yeah. No, thanks to everyone for pulling this together. And let me just say, so I'm Cindy Hawk, and I'm a family doctor, and I'm the chair of the Department of Family Medicine here at UCI. I joined here about 2 years ago, and I feel very lucky to be here in this neighborhood. A wonderful group of people, and I feel very, very fortunate for all the groups that are working very hard to keep us connected. And it's really important. We're going through a crisis, a pandemic, like nothing we've ever lived through, most of us. And so it's required us to make many changes very quickly. And so we are trying to adjust as quickly as possible. And I thought I would just offer myself, my knowledge and skills and experience to the community to be a source of information, a chance to have kind of a community discussion, so you will, about what's happening around us, and to answer some common questions that keep coming up. Things are changing very, very quickly. Let me just provide a few qualifications. First of all, I'm not your individual physician, so any advice that I give, you should, if you have questions, you should really check with your own doctor or health professional. And secondly, there's a lot we don't know about COVID. And information is accumulating, but not as fast as the disease is spreading. And so there are a lot of unknowns and a lot of best guesses. And in many cases, we're flying in the dark, trying to respond to something very quickly that has evolved really just over the last few months. And so we really don't know the answers to a lot of important questions at this point. But I've had a lot of experience working with infectious diseases, both in the US and around the world. I was involved in the HIV pandemic in Africa in the 80s, and have worked with malaria and tuberculosis and typhoid and cholera. So I'm used to dealing with different types of pandemics. This one is very different in many ways because of the severity for a small subset of the people, and also the transmission is very fast, and the incubation period is relatively short. So all of those factors affect what we need to do in order to reduce the spread. We're in this together. It's really a community-wide effort. So what any of us does can affect all the rest of us in the community. And so I think it's really important that we take action to protect ourselves, but also to protect our community around us, because our behavior will affect others. So, so thank you so much, for your interest, and I'm happy to do this on a somewhat regular basis if there's interest and continued questions. And I'll also just say briefly that I couldn't be more proud of UCI and their efforts to respond to this crisis. We have enacted changes as fast as I've ever seen in my entire medical career over this last week in response to what we anticipate is happening around us. And so it's been really inspiring to see my colleagues, from the medical students to the nursing staff to the custodial people. Everybody is pitching in and helping to the best of their ability. I couldn't be more proud of their response, and many people putting themselves in harm's way in order to address this crisis. So, as you know, we're recommended to enact social distancing, physical distancing, in order to reduce the transmission. The transmission of the virus is through respiratory droplets. And it's not aerosolized, that is, it doesn't stay floating in the air for a long time. It comes out in droplets, coughing, sneezing, speaking, and those droplets quickly settle down over a period of seconds when they come out. But if you happen to be in the wrong spot and a droplet lands in your eye or nose or mouth, then you've got a dose of that virus, right, from an infected person. So it really has to be pretty close droplet spread. We also know the droplets can live, the virus can live on surfaces. On some surfaces, it looks like for up to 3 days. But the length of the time the virus lives on a surface really depends on the conditions, the temperature, the humidity, the type of surface, etc. So it's we're learning more about how the virus lives on surfaces in different conditions. So the comment about what do you touch at the grocery store? Well, you know, if someone coughed on that apple that you pick up, you could conceivably get those droplets. And then if you rub your eye, you've just contaminated yourself, because it has to, the virus can't enter the body through the skin, and it enters through mucosal membranes. So that's the eyes, the nose, and the mouth. So that's how it gets in. Incubation period, up to 2 weeks, as little as 3 to 5 days, it looks like, somewhere in that range. And of course, the symptoms being fever, dry cough, body aches, fatigue, and a number of other symptoms, some GI symptoms as well. So we know that up to maybe, it looks like around 20% of people who are infected are asymptomatic, meaning that not everyone who can transmit the virus has any symptoms. So that means just watching out to, avoid people who are sick is not going to guarantee that you won't get exposed, because someone who's completely asymptomatic has the potential to transmit the virus. So those are some of the basic principles of how it's transmitted and so forth. And I'm sure you've all been reading a lot about the measures that we can take. Let me stop there and just make sure that that was clear, and to see if there are any questions from this group before I get to the questions that were submitted earlier.
Was that clear for everybody? Some new information, all new information?
How do you ask a question?
I think it's fine to just go ahead and verbally ask a question. Is that okay? Or would you rather have people type and submit through the chat?
Cynthia, there were a couple of questions that people had submitted prior. I don't know, do you have those with you?
Yeah, I've got those. I can go down those questions. So
why don't we start with that and we
okay.
come back.
I'll start with those, because that okay, there we go. Okay. Okay, so first question is, there was a story about a person who had shooting pains and then a high fever. Is this associated with the virus? Yes, the virus can cause aches and pains in various parts of the body. Myalgia, in some cases joint pain, yes, that can happen. Most people who are symptomatic have a fever, and many people, the majority of people, will also have a dry cough. Second question, I'm a high-risk person and have been having a friend grocery shop. She leaves the bags at my front door and I bring them in, but now I'm hearing that the bags should be wiped down. How do you wipe down a paper bag? And do you wipe down every item that's in the bag? Okay, so basically, as we discussed, if a droplet containing the virus goes onto a surface, it can live there for up to a few days. There are certain surfaces that allow the virus to live longer. Usually, if a virus gets really dried out, it won't live very long. Most of the time, it needs to be moist to stay alive. But but we don't know for sure. This is something that we don't really have enough information about. I guess I would suggest, in my opinion, paper bags that you're bringing into the home, if you put them in the sunshine, ultraviolet light actually does sterilize things. We don't know if it's going to decontaminate COVID droplet contamination. We're not sure. You could just choose to throw or recycle all those paper bags. And then the items within the bag, in my experience living in the developing world, I became a big fan of bleach. So I would basically make about a 10% bleach solution and wipe everything down with bleach. We know that bleach is a really good disinfectant that kills many viruses. And so a mild bleach solution to wipe things down. Even you can even soak fruits and vegetables in a mild bleach solution and then rinse them off and let them dry. So those would be precautions that you could take to be on the safe side. At this point, we don't really know that much about transmission through inanimate objects like that. We know it theoretically it can happen. We just don't know how likely that is. And I would agree that it's going to be really hard to bleach down a paper bag. You're probably going to have to just recycle it, or maybe the sunshine will help. Okay. Another question, the listserv has folks offering books, plants, and toys to each other. What should we be doing for items that we put out for others? And make sure that they're safe before we bring them indoors. Again, I would encourage, anything that can be thrown away, recycled, I would just go ahead and do that. If it's in a paper bag, and then if it's something that it's a surface that can be bleached down, I would bleach it. Just to be on the really safe side. And then the same thing holds for children going to the playgrounds. You may have heard that LA actually closed all their playgrounds because of concerns about contamination. The playgrounds here in U Hills are still open, but theoretically the surfaces in the playgrounds could transmit the virus if they were contaminated. And so, the option is either skip the playground or go to the playground with the bucket of bleach water and bleach everything down before your child plays there. That's hard to do in a playground. Regarding swimming pools and hot tubs, good news is there's no evidence that COVID can be transmitted in that way. So the pool and hot tubs appear to be safe. Again, we want to maintain our distance, because if you're swimming, a lot of people are swimming really close to one another, and some people have it. They could theoretically blow out, some droplets that then could land in another person's mouth or eyes or something like that. So as long as you maintain the adequate distance between swimmers or in the hot tub, it should be okay as far as we know. And likewise, walking outdoors, 1 meter or 3 feet would be the minimum distance. The ideal distance we're saying is 6 feet or 2 meters, because in that 2 meter distance, droplets will drop down to the ground. Let's see, there was a question about basketball, playing basketball. And yes, it's going to be hard to keep a basketball really clean if there's droplets. I think that any kind of ball that people are touching, anything that we touch and then perhaps touch our face, there's the potential for contamination. So I would say those would be higher risk kinds of connections. Okay. Likewise, I guess if you think about yoga, those or Tai Chi, those kinds of outdoor, if you're doing those outdoors, as long as you maintain a safe distance apart and are not sharing items that you're touching and then touching your face, those should be okay. There's a question, how can we support those in bad domestic situations who are now isolated in a possibly abusive situation? That's a tough one. And we do know that domestic violence can oftentimes increase in times of stress. And this is certainly a time of stress. And so if you know someone in that situation, number one, I would try to reach out to them on a very regular basis with phone calls or texts or emails to just let them know they're not alone. They're not emotionally isolated. They have an advocate or a friend. Second, if it's really a volatile situation, they should know how to get into a shelter so that they can keep themselves safe and not be isolated with a potential abuser. So I think helping the person understand that they have options, safe options to get out of a potentially violent situation would be very important. And then the last question that came in was, how can we explain this to our children and underscore social distancing? And so I think this is a really important question. I think this has the potential to frighten lots of people, and especially children who don't really understand what's going on. And so obviously how we explain to a child is going to depend on their developmental age and what they're able to comprehend and manage. We don't want to create undue anxiety in the children, but we need to help them adopt safe behaviors. And so I have grandchildren right now, for instance, 2 and 3 and 9 years old, and we're talking on a regular basis. And we talk about, that there are germs. You can get germs in certain ways, and we want you to stay safe. And there's certain things you can't touch right now because they might have germs, right? And that mommy and daddy or your family will keep you safe. And we want you to be safe and healthy and to avoid those germs. And so, we want to try to shift their behavior, but not instill a great deal of fear or anxiety in the children that anything they touch could be dangerous or harmful.
That's good stuff.
So that's the end of the questions that came in. What else?
I want to ask a question.
Mike Bishop, can I ask a question?
Sure.
Okay, I have 2 children that are living with their mother in Arcadia, and they are self-isolating. They've been isolating for 8 days now. By next weekend, as long as they don't go out and mix with friends, family, as long as they do the self-isolation, is it okay for me to bring them here to my house to continue that self-isolation? Thank you.
Yes. So we know that the incubation period for the virus is no more than 14 days. We also know that some people may be asymptomatic. So after 14 days, someone is asymptomatic and they've been isolated, then you can probably say they don't have it, okay? Unless they picked it up from some other contaminated item that was introduced into the household. So generally speaking, 14 days without symptoms, that's when we're enabling people to return to work if they've had a known exposure. And that's when we're considering people are safe from transmitting infection to others. Of course, any human contact has the potential. So the surest way to stop the virus would be we have no human contact with anyone else. If everyone in the world stopped contact for 14 days or for a month, because some people are actively infected, then it would be over, right? But the cost of that isolation also creates a lot of risks in and of itself. So we have to consider our interactions, try to minimize them to those things that are essential, but know that any interaction could potentially confer some risk.
Cynthia, I would like to give to point out two things for our meeting today. So first, at some point when you ask questions to everybody, I'm gonna unmute everybody. And then if you can wait a couple of seconds to reply so that I can, once the question is asked, I can mute everybody else so that it's gonna be possible, so there's not gonna be any background noise. And the second point is that there are some questions that have been asked in the chat. I don't know if you can see them, otherwise we may be able to read them to you.
Let's see. Oh, I see the chat.
So for example, Deborah asked, wouldn't a few drops of Dawn be better than soap for hand washing?
Oh, wow. Well, I'm not sure if I can answer that question. We do know that soap breaks down the viral particles. Soap breaks the particle down, and water washes it away. And I don't feel like I'm qualified to answer this question on the type of soap, if one soap is better than another. I think enough soap to remove any kind of oily droplets is what you need.
Now, I have a question about going shopping. When we go shopping, how much, and I'm 71 years old, how much danger am I putting myself in? I have clothes in the garage, I change into them, I have hand sanitizer in the car, and I keep the clothes in the garage and I wash hands. So is that enough, or do I have to be careful?
Sounds like you're being very careful, right? And so you're doing a good job. The only thing is, when you're at the grocery, I was at the grocery the other night, and the lines were so long, and we were actually pretty crowded together standing in the line because there were so many people. And, all it would take is somebody standing next to me to cough in my face, and then I'm exposed, right? So you just have to, again, realize that you're trying to maintain that distance and try to shop at times that the store is not so crowded. Or if you find that it is very crowded, maybe come back a different time. The other thing has to do with the items you bring home. Could they have been contaminated in the store, sitting there on the shelf? Do you want to wipe them down before you put them away? So that anything that you bring into your house, you're trying to make sure you're not introducing a potential contaminated object into your house. It sounds like you're doing a very good job.
Thank you.
Cindy, the general question about soap versus Dawn, Eric had something to chime in about, if that's okay with the group.
Please.
Hi, Cindy. And everyone, this is Eric Perlman. I'm in the microbiology immunology department here at UCI. Just to point out that the issue with soap is really important. And, much as I get my information from my own background and my reading, so much you can get from just reading the general media, like the New York Times, my God. I become a genius just reading that. But a part of this is that you have to know that these coronaviruses, they are viruses that are surrounded by these lipid membranes. It's like an individual, not a cell, but it's like a cell in terms of all these proteins are sitting in these membranes. And these are made of lipids, and the beauty of using soap and soap-like products is that these will integrate into the membranes of the virus, and that will just completely disrupt the virion, the actual active virus particle. And so I don't think it matters too much which type of soap you need. I don't think you need added anything, but if you're using soap and you're washing as described, you will almost certainly be fine. And I think also as you're concerned about groceries and so on, I mean, you can wipe those down, but ultimately you wash your hands and you can be dealing with most of the things that are going to be safe.
He still touches way too much.
I touch too many things. I'm sitting within less than 3 feet of my wife.
But it sounds like he washes his hands very well, right? Yeah.
I do. Look at that. Clean as can be.
Better than the grandkids, yeah.
Definitely.
So there was another, someone who chimed in on the chat. Nick Cayley, could you facilitate that one?
Yes, actually, I know Deborah was asking. I mean, I would like to ask Deborah if she's happy with the answer so far. Okay.
Oh, if I could just say about, because I'm a little bit of a cleaning products geek and kind of researched these in the past. Like Dawn has some enzymes in it, and you probably don't need those. And Dawn is really made for much more thick and heavy oils and greases that you have to scrub off of dishes. So it won't hurt. I mean, it'll certainly work to use Dawn, but it'll just really kill your skin if you keep that up. I mean, just regular soap is fine for the very light oils that are on your skin to separate it from, viruses and stuff like that, and not as harsh as Dawn. Plus, Dawn is all out of stock at the store, so you don't want to waste it.
We had also another question from Susan. I noticed that there are officially 70-something cases in Orange County, yet UCI-MC is already short of masks, etc. Can you explain the discrepancy? Do you think that there are many more cases in OC than this official number?
So, so the clinics and hospitals have a supply of masks and other what we call personal protective equipment, PPE, that we use in the operating room and emergency department and so forth for usual care. All of a sudden, the need for the PPE has shot up, it's skyrocketed because of this infection. And so no one keeps those kinds of stockpiles on hand. And we don't produce PPE at that rate as what it's needing to be used right now. We are not short on masks yet, but we are anticipating that that could happen. So we're already taking conservation methods to try and reduce the number of things that we go through. For example, we used to oftentimes change our mask for every patient we would see. Now we're using the same mask over and over again, as long as it's not contaminated, as far as we know, right? So we're reusing certain equipment because we know we will run short because we're using PPE at rates of, 10, 100 times what we were normally using. And the production and the stockpile of these materials are not, they can't be ramped up that quickly. So across the nation, there's shortages just because all of a sudden we're needing to use much, much more than we ever would have previously.
Another question from Deborah. Is it safe to give one or people a ride in your car? We wouldn't be 6 feet apart in that case.
Right. So this is a good question. And I actually thought about that. I gave someone a ride in my car today, but we sat diagonal. I was driving and she was in the back seat on the other side. So we didn't have 6 feet apart, but we did have 3 feet. And so I think it would be risky to pile, a lot of people crowded into a car. But I think that you could probably give one person a ride as long as you try to keep that distance. Remember, where's that droplet going to land? If someone coughs in the back seat, is that going to be, will the droplet land on my face perhaps, or on me where I might touch myself and then my face? So there is potential risk. It is a closed space. There's some information leaving the windows down might help to kind of, open things out more. But yes, I mean, it's probably best to go in a car all by yourself, but that's just not practical in a lot of circumstances. And people need to get around who can't drive, so they have a driver. And if there are concerns, both the passenger and the driver could be wearing masks. That would also provide an extra level of protection. That's not being recommended at this point. Even as physicians, we're not being recommended to wear masks every time we see a patient. And when we see a patient and examine a patient, of course, we're very close to them. But at this point, we're not being recommended to mask up for every patient. That recommendation may change. There was just an article in the New Yorker by Atul Gawande suggesting that maybe we should adopt that practice. but we're not quite there yet. I suspect we may adopt that.
Another question by Jamal. Are reusable shopping bags potential vector for the virus? And should grocery store ban ban them for now?
Yeah, it's a good question. And yes, they could be. And no, I don't think stores have banned them. Should they ban them? I don't think I'm qualified to make that recommendation, but you know, I know a lot of us have gone to reusable shopping bags to just try to conserve resources. I think if you're using your own shopping bag and you're keeping it cleaned up, I think that would probably be as safe as getting a paper bag from the grocery store. I don't know if our microbiologist would like to comment on this.
So funny you say that. I was just about to step in here. You know, it's interesting when you go to Starbucks these days. Not that any of us would ever step out and do that, but they're saying they don't want. Some of us, but I bring you home a cappuccino. She's very happy. But they are saying they don't want the reusable. You know, it's always they try to give you the cups and the mugs and say, you know, bring them back and we'll give you more. I try to get that to work for me for beer and wine, but it hasn't worked. But they, I mean, in terms of cups, they're saying just use the new ones and recycle it. And I think there may be something to be said for just doing that with shopping. If you have any doubts, any concerns, perhaps the best thing to do is just spend the 25 cents and get a new bag for this, and then you're sure. But of course, then you've got the guys who are packing it for you, and then you've got the guys who are passing it along.
The markets
I mean,
are
there's a
out of
point.
bags. The markets are out of bags.
Those
and
are-
batches.
Oh, they are?
Yes.
Well, we were just at Vaughn's and it was fun.
Albertsons, they're out of bags.
Go to Vaughn's.
Okay.
I'm going to mute this now.
Perfect. From what you've seen in the field, this is Zach. From what you've seen in the field on the front lines, do you have any feel, sense, opinion of where the US will net out on the continuing possible scenarios, ranging from these being less dire than is being projected, such as finding an effective treatment sooner than expected, or being able to contain the outbreak more effectively than is being predicted, to 1.5 plus years of isolation, similar to what we're experiencing now as the virus works its way through the population?
Yeah, well, I wish I could predict the future, but we know that if we don't do anything, we're going to end up like what's going on in Italy. And we know that we probably can't enact the kind of draconian measures that were used in Wuhan, China to get this under control, because we don't have a society in which we can order everyone to lock down and stay inside for weeks on end. So we're probably going to end up somewhere in the middle. And at this point, it looks like we're probably going to peak in terms of numbers of infections. Our peak will probably be somewhere in May to June range, is what it looks like the best estimates are. But there's so much that's not predictable because it depends on people's behavior and how fast we enact some of these restrictions that have been put out. So it's really, you know, a mathematical issue because it's all about exposure, numbers of exposures, numbers of cases, spread, etc. My guess is we're going to end up somewhere in an intermediate place, but that intermediate place is pretty scary. That's a lot of people will die from this, and a lot of people will be very sick. And we're just hoping that the number of people who are very sick don't far exceed the capacity of our healthcare system, because we only have a certain number of health workers and ventilators and intensive care units. And the more the numbers exceed our capacity, the greater the number of people who can't be treated effectively, the greater the number of people who will die. let me
I'm
just
sorry.
let me just reassure again that the majority of people who get the infection, it's not severe. The majority of people who get it will recover at home with no treatment, and they'll be fine. It's just this small minority of somewhere between 5 and 10%, and particularly the elderly or those with comorbidities that are at higher risk of having severe complications.
So can I just add something?
Please.
So I would, again, this is Eric Brown. I would add that if you want to see what the best numbers I think are out there are on the Johns Hopkins website, the Johns Hopkins coronavirus outbreak website. What I was looking at least this morning, is that although things are horrendous in Europe, the actual numbers of those who get sick and recover are better than the numbers who get sick and die.
Oh, yeah.
And those I was including one of my postdocs who's from Italy and extremely concerned about this, of course, for her family. You know, this is one thing that as I put this to her and point her towards this, that yes, there are a lot of people dying, but there are more people who get sick and who then recover. And that should give us cause for optimism.
That's right. That's right.
Carol is asking, are we more at risk at our local Albertson since a firefighter from our station is positive and they shop there? So better to shop elsewhere?
I think it's just a matter of time before probably every grocery store has someone shopping there who's had it. So I think we happen to know about this one. I also think that because our testing capacity has been very, very limited, that the number of infections in the community is much higher than what we have been able to identify at this point in time. So my guess is probably, if I had to guess, I would say every grocery store in the area has someone shopping there recently who has the virus.
Sarah is asking, are there any 3D printers at UCI that could create masks, gowns, PPE?
I know that the word has gone out, and so we're working with a number of different suppliers. UCI is part of the UC system, and the good news is that we have quite a stockpile of PPE in the UC system. So we're not running out just yet, but we know that we might. And so we're already reaching out to different vendors as well as different entrepreneurs and different groups that are creating masks and other PPE so that we can use those if need be.
Another question just submitted. I have a daughter with a 23-month-old and expecting a second child in April. I was supposed to help while she was in childbirth. She's in San Diego. Is this okay?
Well, you know, if the 23-month-old doesn't have it, it would be better. But the challenge is that we know that children who have it are more likely to have very mild symptoms or even be asymptomatic. This is one of the blessings of this disease, is that so far children are not affected as severely as adults unless they have underlying conditions. And so, and you know, children are of course adorable, and they need to be carried around and snuggled and fed and wipe their noses, and you know, so they're great vectors. Toddlers are great disease vectors, and so yes, I mean the new mother needs support, and the toddler, someone needs to look after the toddler. But there would be a risk in that toddler could potentially be a carrier. And we can't say for sure that they're not unless they've recently been tested, and which would be impossible. We don't have the tests to be testing asymptomatic people. We don't have that capacity.
Jonathan is asking, is there evidence that the COVID virus can live on food and be transmitted when a person eats that food? Do we know whether cooking or microwaving the food will kill the virus? It's safer to eat cooked food versus raw or dry food, for example?
I'm going to turn to our microbiology consultant here for this one.
Me?
Uh-oh.
Yes.
I'm going to turn to the dog, who is really an expert. This is Phoebe. Hi, Phoebe. You know, I think the chances of this, you can't say it's zero, but it's really low. I mean, you know, if you're cooking, it's all over. There's no question. There's nothing going to happen. The issue is when you get raw vegetables and fruit that you want to eat, just wash them well and make sure your hands are clean. I mean, I cannot, you know, I am not a public health expert or infectious disease expert, but to me, the common sense aspect of this is that you take care of yourself. Wash your hands and rinse off your food. And if you're cooking, you know, don't worry about this. The viruses will not survive any kind of elevated temperatures, anything above our body temperatures. So I would not worry about that. If you're cooking, you're safe.
Perfect. Michelle is asking, what behaviors can we focus on, assuming that each one of us has the virus, rather than what we can do to make sure nothing infects us? I fear that the neighborhood as a whole is risking a lot of critical social and psychological functions if we just self-isolate with our individual interests only in mind. What should we make sure we don't do to infect others, or what should we do to be a link in a chain to help others, like sewing masks, etc.?
Great question.
Mm-hmm.
City, one of your favorite areas.
So, you know,
Drink alcohol.
Dean Stamos at the medical school, he said that we should all practice as if we might have it, okay? So that means that we have to consider that we could potentially be a vector. So we want to maintain the safe distance. We want to be washing our hands. We don't want to be rubbing our other people's faces and so forth. And so I think following those safe hygiene practices that we've been talking about will reduce the chance of us transmitting to another or another transmitting to us, right? At the same time, you know, we've talked about, we don't want this physical distance to result in emotional isolation to the point where we get depressed and anxious and cut off from one another. So how do we promote community like we are now in a safe ways? So we stay connected, we're in this together, we care about one another, we're here to support each other, but we also want to be mindful that we're not contaminating each other. And there may be lots of activities that we can do to help our neighbors. And I've been just so encouraged by the committee that's gotten all of these volunteers who are willing to help, and people who may need helpers, people who shouldn't be leaving their homes because they may be more at high risk. I think, you know, reaching out and trying to help our neighbors if they need help, that's a wonderful thing. So I think we can all play a role in reducing the transmission and also maintaining connections and social support with our families, with our friends and neighbors, so that we don't get isolated and then suffer more severe mental health consequences. Because we're seeing that in our Department of Psychiatry is seeing a real upsurge in rather severe anxiety, depression, suicidal thoughts, and so forth among a subset of people. And so this is very anxiety provoking. And so we need to support one another through this.
Carol is asking, are we safe when picking up takeout food curbside? Or what needs to be done for that to be safe, assuming the restaurant is following clean procedures?
So I think this would apply the same as we've been talking about picking up groceries and so forth. You know, you may want to throw the bags away. You take the food out. You wash your hands because you've handled the containers. Okay, if the food's been cooked, it should be okay.
Okay. My iPad asked, could having had the pneumonia vaccine potentially reduce the severity complications if one were to get COVID-19?
I don't think there's a direct connection here. The pneumonia vaccine is for a bacterial pneumonia, and this is a viral infection that causes a very different type of pneumonia. I think certainly if you don't get the pneumonia that the pneumovax, if you got that pneumonia, it would weaken your system and you would be probably more susceptible to bad complications from COVID. So it might help you in that way, but it's not going to protect you from COVID.
Michelle is asking, is there any reason to think that reinfection with COVID-19 is a possibility?
Yeah, this is something we don't know yet. It appears that some people can get reinfected. And so this is something that we're still trying to understand more. I don't know if we have any more information from the microbiologist about immunity after infection.
Okay, now I'll unmute.
Finally, she unmutes me. First time in our marriage. But it's really too early to say. I mean, that is a great point. It's a great question. People are looking at this. And so we're trying to get the information from Wuhan and China, Southeast Asia, and from Europe on this. In theory, people who've been infected should be immune to subsequent infection. But I don't believe, at least from my reading, I don't believe the data are in there yet. But if I was a gambling man, which I am not, I would still put my bets on saying that we will develop immunity. This is what happens. As an immunologist myself, this is what we do. We develop immune responses to any invading organism. And the coronavirus is definitely an invading organism. And I think we will have that. I think we will develop neutralizing antibodies in addition to other immune responses that will keep us safe from a secondary infection. This is sort of what we have seen in past viral infections. You know, look just 3 years ago at the Zika infection and how everyone was terrified of this as it was happening in Brazil and creeping up north towards the US. In fact, you know, a year later, there are relatively few cases in Brazil. Why is that? Because people developed immunity. And I think that's our natural state, is to develop immunity to these infections. I think this is what is going to happen in the case of this coronavirus strain, but the evidence is not there yet. And so I would recommend you stay tuned to this. We do these kinds of interactions and discussions with Cindy, myself, and other experts in the field. And there are a number of really good experts in the field of viruses and viral infection, viral immunology here on the UCI campus, who we can really try to drag in if they're not going to volunteer, who know a damn sight more than I do and can contribute a lot more. But I think from that sense, I think, you know, the reason that there is opportunity to be optimistic down the road is what we're seeing in China, that there were relatively few cases moving forward, that the peak is kind of flatlined, as they say. Same in South Korea. I think there is reason for optimism. But right now, you know, we're going into this, we don't have immunity, and therefore we have to keep all of these conditions and all of these restrictions in place. Be sensible and be safe.
Thank you.
That's my 2 cents.
That was one, too. Thank you.
Jonathan is asking, for how long is a carrier able to transmit the disease? Will their mucus be contagious for the rest of their lives?
Yeah, no, once a person is recovered, we believe that they're no longer likely to transmit. I think the official word from WHO or CDC is that 72 hours after symptoms resolve, 3 days after symptoms. a person is no longer considered contagious. But again, this is something that we don't completely know for sure yet, not that I'm aware of.
So just a point of facilitation, I'm looking at the clock and it is 5 minutes or less to 9. I might have the wrong clock, 5 minutes to 9. Cindy, you offered to take 10 to or so questions, and I think we've gone beyond that. I don't want to be wearing you out. There are questions still coming in. Are you willing to do this again next week when the world changes again?
I think if this is of value to the community, of course, and I welcome other experts. We have a number of other physicians, nurses, scientists, immunologists in the community. So this can be a community conversation. I've learned some things tonight, and it makes me feel really inspired to know that all of you are concerned and connected and looking out for us, our neighbors, and we're in this together. So I'd be happy to do this again.
That's
and
wonderful.
Thanks for setting things up.
Well, so I think Carol just asked a question, and Michaela is helping me facilitate this because my old eyes can't see my iPad and see what those questions are that are coming up. Carol?
Yeah, there was a question for you, Susan. Susan, could you explain the best way for people to ask for help from a community list?
So that's a Hobart and I question. We're working with Aisha to make sure that we get out messages that go beyond, we're using, or they're using Constant Contact to get out we hope, weekly message that says ask for help or ask to provide help. And so we're coordinating that effort. We're also using the listserv, obviously, and we've had a discussion back and forth, as Michaela, you know, all day today about how best to operationalize that data, that information. Are we gonna send it out there to the listserv and let the listserv pick and choose? Are we going to, and in my favor, privatize that a little bit? Because I believe that people who really need help don't necessarily want to ask unless it's private. So I guess, Hobart, I'll throw that to you, but we're also trying to operationalize that at this point.
Yeah, our goal is to, first of all, create 2 databases. One is people who are willing to help and try and look at that in a more nuanced way to see what particular skills they have, what their availability is, all of that. And then we also need to know if people need help, and we recognize that the first way to do that is actually to use the listserv. We're going to encourage people to join the listserv if they're not on it, and sort of make a publicity effort to get people to know about the listserv, because many people are new residents, or many people left the listserv because they didn't like some of the discussions or some of the topics that didn't seem germane to their lives. We are going to be working more closely with Aisha when they're back online. They've been sort of out getting themselves together last week. And when they're back online, working with them to email directly everyone in the community to make sure that they're aware of ways in which they can contact Aisha, UCI, facilities around the county, but also each other. So we're just sort of setting up a network on our own as a safety net here. Did I answer your question?
So also we will make this video available online so that this information goes out. And I will take that a step further and say that I'm going to review the video and compile this information in a way that that is both granular and concise. I can do it.
Let's point everyone to the Facebook page.
Always.
Yeah.
So I will throw the Facebook page back up on the listserv again. And if you have thoughts and ideas, please let me know. If you have abilities, that's even better. Because I'm not great with Facebook. I'm okay.
Hi, Susan. Can I just ask a question? I understand that we have really world famous virologists here who are working on kind of the coronavirus. And I mean, we got something from the vice dean today saying that the group is pretty much ready to just go into some test phase of some medication. So I think it might be nice to have some people from that group talk to over Zoom to the community, you know. Maybe just follow that up. This was sent today to the listserv, I think, or through maybe UCI, I'm not sure. But I can give you the contact.
So let me,
sorry, go ahead.
Yeah, let me speak to that. I mean, these are people who are my colleagues in the School of Medicine. And I'm not sure how much they're checking their listservs, but I can contact them directly. I think it's really important. I mean, I don't want to come across as the guy who's the expert in this, because I don't work on viruses. And my knowledge of immunology of viral infections is okay, but there are people who know a lot more than I do. And I would defer to them, and I will contact several of those people who would be interested, who live in the community and who can contribute.
I'm Uli Bernard, Vera's husband, and just my colleague Mike Buckmeyer of the Department
Mike
of
Buckmeyer is the first one I thought of, yes. Bert Sandler is the second.
So please allow us to pull those people together. The other question that is coming up is Saturday night the best night to reconvene? And I think that really depends on who are the people who are involved.
Well, no one's at work, so it's not a problem.
Can't go anywhere. Can't do anything.
No one's going anywhere. Right?
So is Saturday night the best night?
Probably
or is
not,
there
but,
another time that is a better time?
Yeah, everyone's out partying on a Saturday night, right?
In our driveway. Thank you, Zach. Yeah.
So, well, I'll let the community should determine what works best, and probably just pick a time. So I'm so glad we were able to get started so quickly. So thank you to everyone who pulled this together. It's really amazing.
Thank you, Cindy.
And Hobart and Susan and Eric too. This is Mo, but thank you all.
Thanks, Mo. Thank you. I'm signing off for now. So one or two last thoughts for something to think about next time. Cindy and I started this conversation by talking about how important she understands it is, and I won't quote you, paraphrase you, to recognize the difficulty with isolation in our communities in general. That's before we came to this, and the relationship between people's health and that notion of connectivity or isolation. So that's one thought, how important that is right now. The other is that I truly believe that we're in a certain period of rebirth, and once we get through this, we'll be thinking about things in a little bit different way. So I'd like us at some point, Kath, because City of Family Medicine, those new births and what that's going to mean, what this is going to mean for our infants and children. Not too heavy, but just something to think about and perhaps to talk about another time. Yeah? No?
All right.
All right. Thanks, everyone.
Thank you.
Thank you.
Thank you.
Good night.
Bye, everybody. Thank you.
Stay safe, be well.
You
Yes.
too.
You too.
Thank you.
Bye.
Together. Bye.
Good night.
Good night. Thank you.
Good night.
Night, Cindy. Thanks.
Thanks.